Some new studies and data out this week are giving us fresh insight into ultra-processed foods. A major clinical trial conducted in the United Kingdom found that diets containing ultra-processed foods are associated with increased cravings and higher calorie consumption. And new data from the CDC reveals just how significantly ultra-processed foods contribute to the diets of Americans. CBS News medical contributor Dr. Celine Gounder joins us now. She's also an editor-at-large for public health at KFF News. And Dr. Gounder, so good to have you here to talk about this. I want to start with the study because I think we've all known for a while now that ultra-processed foods are probably not the best for us, but what are your biggest takeaways from this?
Well, so this study from the UK is the largest and longest clinical trial comparing people who are eating essentially an ultra-processed food diet to people who are eating whole foods, a minimally processed diet. And what they found was both groups were trying to lose weight. The group that was on ultra-processed food lost half as much weight as the group that was eating whole food, even though they were consuming diets with the same ingredients, so to speak, so the same amount of fiber, sugar, and so on. And so it's not just the fact that you have certain ingredients, it's also whether the food is processed or not.
So it could be beef, tomatoes, potatoes, I don't know, but it's different whether or not how you actually put it all together.
Yeah, that's right. And so what we're seeing is that patients, or people, I should say, who eat these more processed diets, they're consuming more calories, they're consuming the calories more quickly, and so they're more likely to overconsume food. Whereas if you're eating whole foods, you're actually chewing more, you're eating more slowly. So that allows you to reduce your intake instead of wolfing down as much food as you would with processed foods.
Yeah, I don't know why I came up with beef, tomatoes, and potatoes out of all things to go to right here. But here in the U.S., I also want to ask you about this new CDC report that finds Americans are still eating a lot of ultra-processed foods. What do you think of that?
So the CDC report says that 50% of the adult American diet is ultra-processed food, over 50%. And for kids, it's over 60% that is ultra-processed food. So we clearly have a lot of room to make improvements, especially given our obesity rates in this country, the number of people who are overweight. And you don't have to cut out all ultra-processed food to lose weight. Even cooking a few meals at home a week can make a really big difference.
Yeah, that's one good tip. What other things should people do in order to cut back on their consumption of all this?
Well, you know, one way I think about it is shop along the edges of the store. So refrigerated section, your frozen section to some degree. Frozen fruit, frozen vegetables are actually a pretty good way to go. Keep longer, and they're often cheaper than the fresh. In addition to that, if you look at a package and the ingredients look like a chemistry set, it's probably ultra-processed food.
Like if you can't pronounce the things.
If you can't pronounce the things, it's probably something you want to steer away from.
All right. Dr. Celine Gounder, thank you very much.